Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Mapus. On this episode, we are, as usual, joined by guest Vaughn Bowles, and he is the Public Information Officer for the Incident Command Center for the Menominee Indian Tribe of Wisconsin, and he is here to answer some of our COVID-19 questions. Welcome, Vaughn.
Morning.
So the first topic I wanted to talk about was the recent MTL Mask Resolution. Can you just kind of give a brief synopsis, I guess, of that?
Yeah, so let's talk about the mask resolution because I've gotten questions about that from members of the community too.
Okay.
So the mask resolution was passed as kind of a suggestion for all the tribal members. We'd like everyone to wear masks to ensure public health and public safety on the reservation. One person asked, what happens if you don't? How is it going to be enforced? Well, at this point, we want people to choose to follow the law. We don't want to be punitive about this. And so we're asking that, individuals wear masks when they're out and about. Currently, all tribal employees have to wear masks at work. If they're at their workstations and they're more than 6 feet away from other individuals, they can take their mask off. Educational and government facilities will be providing masks to guests and visitors that don't have masks. There are some exceptions for when, you don't need to have a mask on because some people are like, I saw this person walking around without a mask. Yes, okay, valid. But some of the exemptions that exist are, people can be outside, and if they're social distancing, they don't need a mask. So if they're more than 6 feet away from someone that is not a member of their family, they're okay. If they're doing exercise and they're outside, they also don't need a mask. The CDC has made recommendations about that. They feel, running or jogging, doing strenuous activities with masks could reduce your airflow. And so they're saying exercising without a mask outdoors is okay. During sporting events, same type of thing. The players don't need to be wearing masks. If you're at home with family members, you also don't need a mask. If you're in your personal vehicle with family members, you also don't need a mask. If you're eating or drinking, that should be common sense. You can take your mask off to eat and drink. If you also have a medical condition, some sort of respiratory illness and stuff, where it's hazardous for you to restrict your current amount of air intake, like if you have COPD or something like that, or severe asthma, the CDC is recommending that, you refrain from wearing masks. Interesting point is if you're communicating with the deaf, you can also take your mask off because sometimes they rely on lip reading. Also, if you're at any sort of service that requires you to remove your mask, you can take it off. I myself got a root canal this week. It was good times for everyone. And so they asked me to take my mask off for that because it would have been hard to do otherwise. Also, if there's a building that needs to confirm your ID, or if you're talking with a law enforcement officer, you can take your mask off so you can be properly ID'd. In addition, if you're working with medical providers or emergency response personnel, they might also ask you to remove your mask. So the mask thing isn't an all the time, everywhere sort of condition. I mean, there are places and times where it's not appropriate or it's just not viable for you to wear a mask. And so you may see people outside that don't have masks. It's okay. We don't have a hotline for you to report people that are not wearing masks. We're just going to throw that out there. We're just asking people to be considerate of others in the population and use them when appropriate.
Okay. I think you kind of covered that, but are there masks being provided to the public?
So there's not a mask program to distribute them to the mass public right now, but for all tribal employees and the visitors to the buildings, if you don't have a mask when you come, you'll definitely be provided a mask so you can safely interact with the employees or individuals within a building.
So what are the plans for school athletics in the fall?
So right now, MISD has the sports regularly scheduled on their website. There may be changes coming in the future, and we can keep you updated on those. As far as the tribal school is going, I spoke with Lori Corn today. Their team is reviewing the CDC guidelines regarding sports and athletics. They will make their final decision in a few weeks, and they'll release those announcements to the public regarding what sports the tribal school is going to be doing.
Okay. So in our responses that we received from the recent poll with the community, I saw that there was multiple people that were worried about seeing people out in the community that they knew were supposed to be in quarantine. So what should people do, if anything, if they see other people that they're like, oh, they're supposed to be in quarantine?
I'm going to start by saying don't confront people that you know are supposed to be in quarantine. And the reason for that is you don't want to expose yourself. You want to limit that exposure as much as possible. And to be honest, if there is someone that should be in quarantine and isn't, that's an issue that's between them and their healthcare provider. I know some people have been out who have been under quarantine, but they've fulfilled their quarantine time and they've been released. But people may or may not know when someone goes in or out of quarantine and is safe to be in the public again. So just because someone went into quarantine doesn't mean they should be permanently locked away, and they may be out in public again. They also might, be out for, groceries or necessities that they wouldn't otherwise have available to themselves. In the event you do see someone that you know should be in quarantine, you can also talk to the managers of the building and talk to them about how they're encouraging individuals to, take precautions, wear masks, and stay at home if they are sick. But I'm just going to stress it again, in no way should you go and confront that person and be like, you shouldn't be out in public, because you could expose yourself. So you'll need to take precautions, and we hope that individuals that do contract COVID or any other sort of illness are trying to be considerate of others and trying to keep the community as safe as possible as well.
The next question was, is hazard pay still occurring?
So hazard pay for tribal employees has been discontinued at this point. Part of the reasons for that is the tribe has taken a lot of the precautions that have been recommended by the CDC to keep employees safe in their places of work. Due to the science and the kind of the information we have provided now, we know how to keep ourselves safe from COVID. And so the hazard pay portion has been discontinued for everyone except for the tribal clinic employees who have or may have direct exposure on a regular basis.
Okay. And do we have any more information on long-term effects of COVID-19?
So science is a process, again, and because COVID is so new, we don't have a lot of definitive answers on the long-term repercussions yet. There is still a lot of conflicting data. I read a report this week that said, you may lose immunity in 3 months after contracting COVID. And another one says you may have immunity for up to 17 years. I'm not sure how they calculated that. I didn't get a chance to fully read that one. So there's a lot of conflicting information out there still. And so we're not sure yet what a lot of the long-term effects are, just because we've only had this virus present in the wild for a total of 10 months, which isn't a lot of time to work with. So they're still looking into what some of the long-term ramifications might be.
Gary, did you have some questions?
Yeah. So our IT department just got some temperature scanners. Is this just for tribal buildings or reservation countywide?
So the temperature scanners or the temperature kiosks are for the tribal buildings. I believe county is working on purchasing some of the same or similar types of kiosks and getting them into their facilities. But right now they're just for the tribal buildings. And they're also for those who visit, any sort of contractor or contractor delivery personnel and the employees to use.
Okay, so that kind of answered my second question. Does the tribe have plans in place for employees who have fever or come to work sick?
Yeah, so for any tribal employee that comes to work with a fever or sick, they request that person immediately return home if they have symptoms. And in the event that it's COVID related, that's essentially an excused illness. But if it isn't related to a COVID infection, then that person needs to go home and use either personal or vacation time for that time that they're out of work, just like they would any other time.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. We're aiming to do weekly updates with Vaughn. We welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.